Hello and welcome to Embracing Senior Health. This is sponsored by Embrace Hospice, and I'm your host, Candace Howell. This great show airs every Friday right here on WMBF. And today we're focusing on insurance. Specifically, we're going to talk about some Medicare options and some things that you need to know about. I've got some great guests here with me today. Patti Fink is back with us from Embrace, of course, and she's a regular on the show. And we also have Andrew Vovou and we have Chris Jones with us, and they're both from Coastal Security Insurance. And this is a big topic for seniors insurance and understanding what their options are. And I'll be honest with you, watch it on the news, read about it in the paper. It's very confusing with what they're faced with right now. So I want to talk to you guys about, when do you sign up?
Well, you pretty much sign up when you are turning 65, and the insurance term that they use is called age and in. For most people, that's when it's going to happen. Occasionally, you may have someone who is on disability, full-time disability, and they could qualify for Medicare before then. But 3 months before you turn 65 or 3 months after you turn 65, you need to be contacting the Medicare Service Center and enrolling.
And so, Andrew, would you say it's an important thing to reach out to a professional like you or Chris to discuss what all the options are? Because I could imagine this is probably a giant stack of paperwork to try to figure out all of a sudden because you've become of age.
Absolutely. There's a lot of different options, and depending on your financial situation and what affordability comes into effect a lot of times as well, and just really having a good, complete understanding of what you're buying when you purchase a Medicare plan. Or if you even are required to have a Medicare plan. Some people might have a retirement plan that will cover them appropriately, but that's something that a professional absolutely has to sit down and go through with you. You see a lot of people telling you just go online and sign up, but when you talk to somebody, you get a lot of free advice.
That's a scary thing, to just go online and sign up. I don't know that I would be comfortable with that, even being very online savvy. Patti, what do you see with the folks that you guys care for and are working with all the time with Embrace? What are the things they talk about with dealing with insurance?
I think the biggest thing is which Medicare plan to get. What kind of supplement do I need? Do I need that if I'm on hospice? Do I not need it if I don't have hospice? A private insurance, do you need that as a secondary coverage? And I'm with these guys, it's like I'm not quite sure, so I'll call one of you and say, I have this patient who has questions about the Medicare Part B supplement, or what should they get? And it is something that you really do need to speak to a professional about to get the right advice.
And I think the other thing to point out that's really important too is it's not just about the people who are of age to actually take part in these programs, but also their caregivers. If a child is taking care of them, they need to understand this too, because a lot of times they're dictating, to the parent or the grandparent, whatever it may be, this is what you have, this is what you don't have, and this is what you need. So relying on some professionals, I would have to imagine, is very important. So do I still need to have Part A or Part B? How do you know?
You absolutely need to have them. And Part A, everyone is going to have Part A at some point, and it actually takes care of their hospital bills. Part B is going to take care of doctors and emergency rooms, things like that. And then there's something called Part C, or some people may have heard of Medicare Advantage. Part C is Medicare Advantage, and then Part D is prescription drugs. What they need a supplement or a Medigap plan for is to take care of the 20% that Medicare is not going to pay, things like the co-insurance and deductibles and some other technical things like that. But there is a lot of money that's left on the table if all you have is Medicare A and B. Medical bills can get into hundreds of thousands really quick, and you could have a $20,000, $30,000 bill if you do not have some kind of plan in place to help you pay for it.
And that is one of the worst things in terms of going to collection that can train wreck your credit in a hurry, is medical bills. Andrew, working with you, how do you guys work with your clients to make sure that they do understand Part A through Z, it seems like, because there's so many different?
Well, the first thing that we do with clients is sit down with you, and we want to learn about your financial situation and your health situation, and any of the qualifying factors that you might have that might trigger a different type of insurance be necessary. It's a very good thing to have all your Medicare insurance, but there's other options out there as well if you are able to exercise those options. It's just one of those things we have to learn about your complete financial situation, really analyze it, make sure that we have a good picture and make sure you understand everything we're talking about.
So is it safe to say it's like a menu? You take a look at the menu, you see what you need, and you put something together? And I would imagine it's not a one-size-fits-all.
No.
So let's talk a little bit about Medigap, because you mentioned that term. So let's explain exactly what Medigap actually is.
Actually, you're going to have two basic kind of plans. What I call Medicare supplement plans are insurance plans that are sold by private insurance companies. It's also the kind that I recommend, if you can afford it, that you get that kind of plan. You would get that, and it's going to take care of that 20% that Medicare doesn't. So if your mom or dad or you have to go to the doctor or the hospital, they just hand them their Medicare supplement card when they get there. Not a lot of hassle, but you do have to pay the premium each month. Again, this is my personal opinion. If you can afford that, that's the kind I would get. And I also would get one plan and stick with it. A lot of times you have new companies coming into the state each year, and they'll have a really good introductory rate, but that rate can change on you. So you have to be really careful about thinking you're going to get a bargain each year. And the other kind is the Medicare Advantage, and it is private insurance companies and CMS, the Center for Medicare Services, working together. And those plans can work great for some people. Perhaps if you're a lower income and you can't afford the premium that would be with the Medicare supplement plan, you can get a Medicare Advantage plan. Sometimes there's not even a premium associated with that. Sometimes there are. It can differ from county to county. It gets kind of involved too, but those plans can work really well for certain people.
Okay, very good. Well, we're talking about insurance, folks, and we're going to have more coming up after the break. One term we mentioned was Medigap. We're going to talk a little bit more about that and what happens when you cancel any policies you have, or when do you cancel or change things up. Stay with us. We'll be right back. You're watching Embracing Senior Health.
If your doctor refers you to a hospice program, you may continue to keep him or her as the primary care physician. Many hospices ask you to take their medical director, but you do not need to do this. Your doctor can be your doctor through your hospice journey. Many people think that because you've been referred to a hospice services that you cannot remain in your home and need to go to a facility. That is not true. Your end-of-life care can be provided by your hospice team in your home where you're most comfortable.
Welcome back to Embracing Senior Health. I'm Candace Howell. This show is brought to you by Embrace Hospice, and we're talking about a very important topic today. We're talking about insurance, and specifically one of the things we mentioned before the break was Medigap, and what that means. And the way I interpret that is it's really the gap between insurances where you might fall through the cracks and have to pay some extra out-of-pocket money. So let's talk about Medigap one more time for the folks that are just tuning in. What is it exactly?
It is an insurance that's going to help you pay for the amount of your bill that Medicare itself does not pay for.
Perfect. So, can the company at any point cancel your coverage if you have Medigap?
If you have a Medicare supplement plan, then that's not going to be canceled. Matter of fact, when you first age in at 65 or whenever you become eligible for Medicare, then it's a guaranteed issue as long as you do it during that time. If they start trying to move each year, finding a better deal on that, then they have to go through underwriting, and so they may be declined. Another reason why you need to be really careful. With the Medicare Advantage plans that we talked about, it works pretty much like our new health care plan does, where there is a open enrollment period each year, and whatever you do, you're going to have to do during that open enrollment period, which is from October till December, about mid of October to middle of December. And then you will have another opportunity, if you don't like the plan that you're in for some reason, that you could either just go back to regular Medicare A and B, or you can move to another plan one time. And even with that, the rules can kind of be changed from year to year, so you really have to be careful when you start trying to make a move somewhere.
It's difficult to understand all the language in those letters when they come, or the emails when they come. It's hard enough to understand Medicare in and of itself with all the different parts, but also, you know, we were talking in the break, Andrew, you could just get a letter in the mail and then all of a sudden you're supposed to act on it, and if you're not, you know, if you don't do it and you miss the enrollment, I mean, what happens?
Well, the important thing is to know when you're aging in to Medicare that it's your responsibility to sign up. And I can tell you, you will receive a lot of mail from insurance companies trying to solicit your business through the mail because they know that you're aging in. So normally when our clients start getting those letters, we'll get a phone call saying, hey, do I need to sign up for this now? And that's when, yes, we have to start looking at what plan you need and make sure that when you turn 65, we have the appropriate plan set up for you.
Yeah, I think the biggest thing too is just make sure also that it is a legitimate letter from who it's supposed to be from before you sign up for it too. We've talked about that before. So let's also talk about traveling now. So if you have Medigap, Medicare, you're traveling, we'll talk domestic and then we'll talk international. What are some of the things you need to think about with that? You get hurt, you're away from home, maybe you're in another state. What happens? What could happen?
Well, if you're in another state and you have Medicare, you're pretty much covered for emergencies. There's really no issue there. Domestically, as long as you have Part A and B, you're going to have your coverage amongst the states, amongst the country. You don't really have to worry too much about that. When you travel out of the country, that's when you want to check with your supplemental or Advantage company and make sure that you do have some emergency coverage. Only specific plans have coverage for out of the country travel. And that you absolutely have to consult with your insurance professional to make sure that when you are traveling, you do have the coverage you need, because that's when things can go wrong.
It mirrors your regular major medical plans a lot. You just really do need to check if you're going to California or Texas or Mexico and make sure that there's a network provider there. Even with those things, you'll still have some coverage, but if you get outside of the network, you're going to end up paying a lot more money for what you get.
And let's face it, if we're traveling, we're probably not thinking that anything's going to occur. Most of us wouldn't think, I better check, I'm going to Cozumel, and make sure there's a network provider close by in case you have an accident and you get bit by something or whatever happens. What do you do? I mean, you just kind of leap of faith?
A leap of faith. Well, that would be one way to do it, but it's not that difficult to check and see on the policy that they give you. It'll have some pages up at front that kind of makes it really simple, and it will tell you, it'll give you a chart and show you your in-network and now network coverage. And most of them all will, that's a big selling point if you can take it outside of the United States. So it'll be on there for you. It's pretty simple to figure out.
Good. And Patti, real quick, what kind of chatter do you hear from the patients that you guys work with about dealing with Medicare? Are they frustrated? Is it tough to deal with?
It's frustrating and it's overwhelming, especially the Part D of Medicare. It's falling into that donut hole. How do I get out of it? What is it going to pay? And that's something that these guys could answer, better than I can. Another thing that's overwhelming is which plan. You got A, you have B, you have C, D, E, F. Which one do I need? Which one's going to fit? Also, is there pre-existing causes that's going to make it higher for me? At what age do I go to a different category, and when does my premiums go up?
A lot of good questions.
Are there any help out there to help pay for some of those premiums? So those are the type of questions that I could get from time to time, and of course I'll call these guys and say, help out, what do I need to tell them, because they are the professionals.
And that's exactly what we want to let the folks at home know. If you're not sure, call a professional. You guys are there for them to help guide them through some of those avenues and really be able to spell it out for them on what they need. And you hit the nail on the head, Patti, with something that we're going to talk about in the next block of the show. We're going to talk about paying for policies. It's a very important topic. How do we pay for things? We're going to have that when we come back. Stay with us.
Hospice pays for the majority of medications that patients are on upon admission to hospice. We take care of medications from prescription from your doctor to the delivery of medications to your home. We take care of all of your needs with your prescription medications.
We at Embrace Hospice are not only dedicated to our patients and families, but to our veterans. A retired Army veteran with 27 years and my chief nursing officer with 20 years, a retired Army nurse. We believe that veterans deserve the care for what they did for our country at the end of their life.
Welcome back to Embracing Senior Health. I'm Candace Howell. This show is brought to you by Embrace Hospice, and today we've been talking about insurance and specifically Medicare and Medigap that covers the gap that we can fall into sometimes. I want to talk to you a little bit about, gentlemen, tell us about how you pay for the policy, how that works.
Well, if you're getting the private insurance Medicare supplement plans, then there's going to be a premium that's associated with that, and it will be based on your age, usually in 5-year increments. You would make that payment directly to whichever insurance company that you have taken it out with. The other insurance, the Medicare Advantage plans, is a little bit different. Sometimes a plan may not have a premium with it, or it'll be called a zero premium, or it could be anywhere from the $30 to $100 range. Making those payments, you can either make it straight to the insurance company, or most people will elect to have that payment taken from their Social Security check each month, and that makes it a little bit simpler.
Okay. And the other thing too is, will Medigap cover drugs, prescription drugs that they may need, Andrew?
It will, if you have a Part D. A Part D is one of the other pieces of the puzzle that you have to get in. You have to have a qualifying drug plan when you age in. And there's a few different types of qualifying drug plans, but the Part D is the one that you hear the most talk about, and that will cover your drugs. There are a lot of those out there, and that's one of those situations where you really have to sit down with somebody and look exactly at what medications you take and see what plan's the best fit for you.
And I can imagine that's a difficult conversation because those medications are going to change probably rather constantly depending on what kind of ailments they're dealing with. And thinking about long-term care, when does the government kick in? When does the government start to pay? Because we were talking about a number with long-term care of about $200 a day if you're in a nursing home. That's a lot of money, $200 a day.
The government or Medicare will only pay for a limited amount of long-term care, and that's going to be in a facility, and they'll pay for that only after you've been hospitalized. So if you have a long-term care policy will have qualifying events, and if you meet the criteria for your long-term care insurance to kick in, the government normally won't pay anything at that point because you're able to be home or in a hospital or a facility where you can get your care. Long-term care insurance is something that's definitely important to look at, but it's much different than the Medigap.
And just to clarify, does it cover home care as well?
Long-term care, most every plan out there will cover care at your home if you need it.
And this is a really important thing. I think the common thread here too is that this is a lot to take in for anyone. And relying on a professional, and you guys have a great company, Coastal Security Insurance in Conway. If you guys have questions at home, call a professional that does this for a living that can really help you understand each one of these parts. Medigap, it's a lot of different terminology to wrap your head around. And one of the things we want to do today's show as well is we want to talk about other services that you guys may be able to provide. Patti, I know that so many times you see these folks in these situations where it's tough to understand things. You get a lot of great questions from people, and it's good to have people to call and to check on things and just say, I don't really understand this. So stay with us. Coming up after the break, we're going to get into some other services that you need to check into when it comes to insurance. You're watching Embracing Senior Health.
At Embrace Hospice, volunteers are the backbone of our care. If you feel that you could provide quality, compassionate care to one of our hospice patients, please call 1-855-OPEN-ARMS.
I never want to feel that I can't go to anyone for help. I never want to feel so alone that I consider doing something harmful. If this is you, say something. Please.
I'm encouraged that here at Embrace we have several competent, compassionate, spiritual care coordinators that come alongside the patients at the end of their life and help them in their spiritual journey.
Welcome back to Embracing Senior Health. I'm Candace Howell. You've been watching a show today about insurance, and we've been talking about Medicare, Medigap, lots of great terminology. If you're still spinning from all the things that we've been discussing with the show, call a professional, and that's why we had a few on the show today. Why contact you guys? How can you help?
It can help because, as you see, it can be really confusing. And with the government, sometimes, especially with the Medicare plans, they will kind of change the rules on us from year to year. So every insurance agent that sells any kind of Medicare plan has to certify with the government each year, and then they have to certify with each individual company that they represent. So we'll be up to date on whatever the rules are and any changes. And another important thing to realize with that is it does not cost them any more if they use a professional or if they go online and do it themselves. So come to us and we'll get you some good advice and find out what plan fits you best.
And I think so it would cut down on fraud for these senior adults and not knowing which plan to choose or if it's legitimate.
And Andrew, you guys provide some other services real quick. Tell us about those.
We do write homeowners insurance and auto insurance. A lot of the retirees that are moving down to this area are used to dealing with one company only. We're in a really specialized market, and one of the things that we like to be able to do is to really look at where you live and make sure you have the best price and the right coverage. If you're with a company that's cheaper than us and we can't offer you an option that's a better coverage, we tell you and we're honest with you. We don't try to push it to one of our products.
Very good. Well, lots of great questions answered today. If you have more questions and you want to call a professional, you could give these gentlemen a call with Coastal Security Insurance in Conway, or really any agent as well. And Embrace Hospice is the sponsor of this show, and we're on the air every single Friday at noon right here on WMBF talking about the great topics that affect our seniors, and we hope you join us every Friday. And again, this is sponsored by Embrace Hospice, and we hope you have a great afternoon. Take care, everyone.